I get lots of questions from women who've had a previous cesarean section, whether or not they should have a repeat cesarean section or whether they be a reasonable candidate for trying for a vaginal birth. In this situation, we call it a VBAC or a TOLAC, also known as vaginal birth after cesarean section or trial of labor after cesarean section. It is a very personal choice, and women will choose different things depending on their different circumstances. I really encourage women to discuss it with their doctor, who can look at their records and know their risk factors and really review what their last experience was and see what their personal preference is. Excellent candidates for a VBAC or TOLAC are patients who've had a low-risk pregnancy and also patients who've had what we call a non-repeating cause of their C-section. Women who perhaps had a breech delivery the first go around and had to have a C-section for that reason, or perhaps a baby or fetus that had a cord wrapped around its neck, causing fetal distress in labor and had a C-section for that reason. Again, it's an unlikely event to repeat itself the second go around. If a woman, for example, had trouble fitting the baby out the pelvis, that would be a failure to progress situation. That is more likely to come up a second time. So it involves a little bit different decision-making between the patient and the provider. When women ask me these questions, I like to pull up a calculator, and they're available online. And we can put in together the risk factors of what happened with the first labor and delivery, whether or not they've had any vaginal births, and what their medical complications are. And we can know what their chances are of likelihood of having a successful vaginal birth if we try for that trial of labor after cesarean. Women make different decisions, and it really comes down to what their first experience was all about. For women who had a really long, hard labor followed by an emergency C-section, I find a lot of women, even when they are excellent VBAC candidates, they feel really reluctant to repeat that experience. And a lot of them will elect to have a repeat cesarean because they're a little bit traumatized from their first experience. And I think that that is something we should really look at and support. I also feel like some women who might not be ideal candidates are really motivated to at least try for a vaginal birth. And I'm also very supportive of that. Sometimes women had a hard recovery after a C-section. They really want to avoid a repeat C-section if they can, or they might simply want to have a larger family and know that 6 or 7 C-sections is not the best health choice for them. So they might be motivated to try for a vaginal birth as well. That said, we always go through all the risks and benefits in detail. We try to make a safe and shared decision-making together. And I really like to support women in what they ultimately decide to do.